Is sometimes referred to as the hidden illness because there are no obvious physical signs or symptoms like there are in drug or alcohol addiction. Well, joining us now is Dr. Robert Trestman, a psychiatrist at UConn Health Center. Thank you so much for joining me, Doctor.
It's a real pleasure. Thank you.
So this is a very timely interview because we're dealing with March Madness. We're smack in the middle of it, the NCAA tournament. It's one of the biggest gambling events, I would say, of the year, perhaps.
Absolutely.
So how do you make sure you're having a good time and it's safe, but you just don't take it overboard?
Well, a lot of it is just like with social drinking. If it stays within the context of just having fun, doing what your peers, your friends, and family are doing, and it actually is enjoyable, then it's great. And many, many, many millions of Americans do it. And there are probably 65 to 70% of all adult Americans who gamble at least once a year.
Now, let's take it to the other spectrum. I even admitted to you, I had a friend, obviously not in Connecticut, but I had a friend in the past who was addicted to gambling. And the warning sign is he kept asking for money, and then he would deny that he had a problem when we brought it up to him. But it was just, he was asking for money to cover up the money he had lost there, and he was just spiraling out of control. So how do you know, and what do you do when you know your friend has somewhat of a problem?
Well, what to look for? There are several different things. Obviously, money is a big issue. And people who end up spending money that should be for food, for the kids, for the house, and using that for gambling, that's an obvious problem. If there are problems that they can't stop, if they continue to gamble, even though people tell them it's an issue, if they start finding ways to gamble daily, if they think about nothing else but gambling, all of these are warning signs.
So what are tips? What do you do when you know, okay, this is a sign they're a candidate here? What do you do to help them?
Well, the first step is to challenge them and to say, I'm seeing something that's a problem. It's impairing your function. It's not just an occasional gambling episode. It's all the time. Do you see this? Some people, if it's not too bad, will acknowledge it and be able to stop. But just like with someone who is addicted to alcohol or other drugs, all too often the high that you get overwhelms all of the deficits and negatives, and it's very hard for them to say no.
You brought up a good point to me, because I was saying sometimes people who are addictive gamblers say, oh, it's just gambling, it's not that big of a deal, I'm not doing cocaine, I'm not drinking excessively. But you're saying it triggers the same part of the brain?
Absolutely. The high that we get, whether it is from certain drugs or from the high of succeeding on something really hard, like at the Winter Olympics or in any kind of competition, that's very reinforcing. So too is the high that people get from winning at gambling. And it can be so intense that you ignore all the times you fail. And the same parts of the brain are being stimulated.
So is it that easy to walk away? It doesn't seem so.
For many people, it's not. For 1 or 2% of Americans that are really pathological gamblers, it's not easy.
So let's say you address a problem, you say, hey, something's going on here, and right away do you take them somewhere so they can get some help? Or what if they don't want to go? I mean, how do you help? How do you work this out?
It's an addiction, and it's not like a broken bone that can be just fixed. It's a process of change, and people obviously need to recognize that there is a problem, that it frequently what happens is people start losing their jobs, they're at risk of losing their relationships, their families are in distress, they lose their homes. It's frequently at points of such distress that people are finally willing to acknowledge it and go into treatment and be committed to changing themselves.
It can be devastating. Thank you so much for your help. Well, we're going to give people, our viewers, a hotline number, so hopefully that can help them out. Thank you, Dr. Trestman.
Thank you.
And if you need help, you can call the Connecticut Council on Problem Gambling. That number on your screen, 1-800-346-6238.